Good afternoon, and thank you for joining us today. My name is Andrew Dolphiny, and I'm the Instruction and Outreach Librarian at the New Jersey State Library. And we have with us today presenting Laura Moran, who is a registered nurse and certified diabetes care and education specialist with over 22 years of experience. Working in various fields of nursing, Laura joined the diabetes education team at Capitol Health in 2008 and furthered her career in 2014 by joining Capital Endocrinology Specialists. In 2015, she earned her certification in diabetes education, demonstrating her comprehensive knowledge and experience in the management of diabetes, prediabetes, and diabetes prevention. Laura is currently the program coordinator of the Outpatient Diabetes Education Program at Capitol Health and continues to provide skilled education to the clients of Capitol Health endocrinology specialists. So welcome, Laura. Thank you for agreeing to present today in honor of Diabetes Awareness Month. Before we get started, there are a few housekeeping items I'd like to go over. First off, if you have any questions, you can ask them using the questions box and GoToWebinar, or you can email me directly, and my email address is on the screen here. We will be glad to answer your questions. There is a copy of the presentation as well as some other handouts available for you, which you can download from the handouts section of the dashboard. You can just open that, click on the file, and it should download. People have reported using Google Chrome that there might be an issue with downloading the PDFs, and that seems to be a personal setting in Google Chrome dealing with PDFs rather than anything else. So if you are running into that problem, you can always try a different browser, or you can wait for the follow-up email where all of those handouts will be attached. So there will be a survey prompted at the end of this webinar, as well as in a follow-up email. If you could please complete it, we greatly appreciate your feedback. And if you are looking for more information on diabetes services through Capitol Health, there is a web address on the screen, and I will send that out in the chat once we get started so that everybody can have a live link to that. One last thing from me is just a brief overview of the GoToWebinar dashboard for those of you who might not be familiar. If you do not see this dashboard here, look for this orange box with a white arrow, either at the top left or right-hand side of your screen. That will open and close the dashboard, and it's possible that the dashboard loaded closed on you. If you still can't find the video or the dashboard, look for a blue clover type icon in your taskbar at the bottom of your screen. Maybe you're working in a different program or you tapped out of it by accident. Finding that icon and clicking on it should bring up the video as well as the dashboard. At any point today, if you have any problems or you can't figure anything out, please use this raise hand button here. You can click on that. That'll alert me that you are running into an issue, and I will get in contact with you, and hopefully we'll be able to resolve it. As I mentioned before, there are 5 handouts for today in this handout section in the middle. And again, if you have any questions at all at any time, please type them in this box here, hit send. That'll get sent to us, and we'd be happy to take care of that for you. So that is everything I have. So I would be glad to turn it over to Laura.
Thank you so much, Andrew. So I'm gonna go ahead and show my screen. And is it up there, Andrew?
All right, yeah, looks good.
Okay, excellent. So thank you so much for having me today. I am going to turn on my camera. Sometimes I talk a little bit with my hands, and sometimes that's beneficial. So if that's working there. Okay.
All right, we can see you.
Okay, excellent. Excellent. All right, well, welcome again, everybody. Thanks so much for joining me today. I am, as Andrew said, a nurse and certified diabetes care and education specialist. And I'm gonna kind of go through soup to nuts, A to Z, kind of everything you need to know a little bit about diabetes. So we'll go ahead and get started right away. It's chock full of information today. Let me just see how I can move through my slides. Not letting me advance. Any thoughts, Andrew? Oh, there we go. I got it. Not tech savvy. Okay, so the things that we're going to do today, we're going to understand the process of diabetes in the body, talk about the signs and the symptoms of diabetes. So how does that feel in the body? We'll talk about the target goals for your blood sugar readings, talk about the exercise guidelines for diabetes management. And then we'll talk about what we teach for meal planning, which is called the plate method, and we'll kind of review that and what that's supposed to look like. And we'll talk about just some basic meal planning tips. I welcome any questions. I'm happy to, stop my presentation if there's an urgent question about something that we're talking about. So feel free, as Andrew said, to either use that chat box or to email him, and he can certainly interrupt me at any point, okay? So I think it's important for people with diabetes to understand that diabetes, first off, is very common. 34 million people in the United States have diabetes, which represents a little more than 10% of our population. 88 million adults have something called prediabetes, which we're going to talk about in a little bit, but it certainly puts an individual at risk for developing diabetes, and that's over a third of our adult population. Currently, adults over the age of 65, 1 in 4, about 25% have diabetes, but that number is projected to increase to 1 in 3, meaning a third of our adult population will have diabetes. So with all this talk about the coronavirus, COVID-19 being a pandemic, diabetes has actually been a pandemic for a number of years. Pandemic meaning that it is a disease that is critically on the rise throughout the world. And that is the situation with diabetes. So first and foremost, you're not alone. But secondly, there are lots of resources that are available, and there's lots of knowledge out there to help you and support you in managing your diabetes. So I want you to know that that's available to you. Okay. So it's best to just understand, if you've had diabetes for a long time, or even if you're new to diabetes, exactly what's going on in your body. So when you eat your food and you chew it up, it breaks up into different parts. So you have vitamins, minerals, water. One of the components of food is protein. Another one is carbohydrates. Carbohydrates, probably a word that you've heard before, turns into sugar. And that sugar gets absorbed into your bloodstream. And that sugar is your energy or your fuel for your body. It's the only fuel that your brain can use. So it's absolutely necessary that we eat, and it's absolutely necessary that we do consume some carbs in our diet as well. But once that sugar absorbs into our bloodstream, it's ready to get into our cells to give us energy. So our brain to think, our heart to beat, our lungs to breathe. But it needs something to get the sugar out of the bloodstream and into the body cells. And that something is insulin. And insulin is a hormone that we make in the pancreas. And insulin kind of trails behind the sugar, waiting for a body cell to ask for energy. And when a body cell is like, hey, I need some of that sugar, the insulin's going to go over like a key, unlock that cell door. Once that cell door opens, the sugar can leave the bloodstream and enter into that body cell, so that that body cell has energy, so that you're not feeling sluggish or tired throughout the day. So insulin is literally, figuratively, the key that gets the sugar out of the bloodstream and into the body cells. So once you eat a meal, you get a flood of food turning into sugar, and you get a flood of insulin coming in, and those insulin keys are moving that sugar around wherever it needs to go in the body. After about 4 hours or so from that meal, insulin has decided that I've distributed the sugar where it needs to go. I've filled all of the cells wherever they need to be. My job is about done. And so it will move some sugar into your liver to be stored later, which we'll talk about in a second, or it will convert it into a fat, that fat being a triglyceride. And then your body will utilize the sugar that's in your liver, kind of like a slow leaky faucet, to kind of just drip out a little bit of energy until the next meal comes in. So you eat your breakfast, say at 8 o'clock. about 12 o'clock, your liver's just kind of dripping out a little bit of sugar just to keep you going until the next meal comes in, until lunch comes in. And that process just happens automatically all the time. Okay, so hopefully that makes sense to everybody. And if there's any questions, I'm happy to review that or go over that on. But the situation with an individual with diabetes is just slightly different. So an individual with diabetes is either missing the insulin piece, meaning that they're not making it, or the keys are not necessarily very effective, meaning that the cells are not allowing that key to unlock the door. So we're going to talk about that in just a moment. Here's a picture so that you can kind of see. There's the blue body cell, and that yellow insulin key is going over, unlocking the door to that cell. And then those red glucose molecules are going to head into that cell once the key opens up the door. So again, diabetes is a chronic disease that develops if there's not enough insulin secreted by the pancreas. So we call that insulin deficiency. The pancreas just cannot keep up with the demand. It's not making enough insulin. Okay. Or the situation could be that the pancreas is doing the job that it's supposed to be doing, secreting all of the insulin that the body should be able to need. However, the body cannot utilize it effectively. We call this insulin resistance. I'm going to talk about each one just a little bit more so that we can make sense of it. With insulin deficiency, the cells of the pancreas are just not producing insulin. If I wasn't sure what type of diabetes you had, I could do a blood test and I would see that your blood sugar was high, but that your insulin level was low, and that lab test is actually called a C-peptide. So that's the test. The C-peptide will tell me how much insulin you're making. So that would be a very low number. So that would signify to me that you're just not making insulin. That's the situation in your body. So this last statement at the bottom here says that this is made worse by a long duration of high blood glucose. So what that means is if your blood sugars are running high and your pancreas sees that, and so it will start to produce more insulin, because it'll say, all right, I need to start distributing that sugar somewhere in the body. So the pancreas is trying to keep up with the demand, and it's working really, really hard to pull those blood sugars down, but it can't seem to do that. After a while, the pancreas gets tuckered out, if you will, and stops producing insulin altogether. So this is why some individuals who have diabetes will start out taking oral medications, and then maybe later on down the line, they're going to need insulin, and they're not going to be able to come off of insulin because their body just stopped producing insulin altogether. So that's one piece of the puzzle. So that's insulin deficiency. The other situation is called insulin resistance. So again, the cells in the pancreas are producing plenty of insulin. It's just that the body can't use it very effectively. It's like the key cannot fit into the keyhole and unlock that cell door. 100% of all people who have prediabetes or with a new diagnosis of type 2 diabetes are in this category. So diabetes in that scenario always 100% of the time starts out as insulin resistance. So the two situations that make insulin resistance worse are inactivity and obesity. So if you went to your doctor when you were first diagnosed, or perhaps you have prediabetes, probably the two things that your doctor said to you were, you need to watch what you're eating, you need to lose weight, and start exercising. And so let's talk about why that's hard, number one, but why that's happening in the body. So for some reason, we know that when a person is exercising, all of a sudden those insulin keys kind of light up and the cells kind of allow that insulin to work more effectively. So all of a sudden those keys that couldn't unlock the door are unlocking all those doors to all of those muscles that are needed for exercise. So you take a walk and all of a sudden those insulin keys are working very effectively, and you might find that if you have diabetes and you take a decent walk, your blood sugar will actually drop during that walk. And that's because your body is responding appropriately to that exercise, that your insulin kind of lit up and kind of did its job the way it's supposed to for that exercise. And the benefit of exercise can last for upwards of 24 hours after you're done exercising. So we love exercise. We definitely recommend exercise. And then the more weight you have on you, the more likely you are to develop insulin resistance. So just the matter of losing some weight, and it doesn't have to be a lot, but losing some weight can seriously reduce that insulin resistance, that the insulin being unable to open up those cells. So let's just look at this thing here, this picture on the right-hand side. So the situation is that we're, with insulin resistance, we're eating our food, our carbs are turning into sugar, that sugar is going into the bloodstream. The cells, unfortunately, are resisting the insulin that was secreted. So the body starts storing that sugar. Remember I talked about before about that it can store it as a triglyceride. So it starts storing that as a triglyceride. So you're gaining weight, you're gaining more cholesterol, you start to feel tired and sluggish, so sometimes you feel hungry, and then the cycle starts all over again. So you start eating, and that vicious cycle leads to inactivity and obesity, which are the two very pieces that are going to make this process worse. So as clinicians, our job is to break the cycle, and we can break that cycle in a number of ways. Lifestyle changes, of course, but there's a lot of different medications, which I'm actually not going to necessarily talk about in this particular lecture today. Unless you have a specific question about your medication, I'm happy to address that. But there's lots of different medications that can kind of break that cycle and help people get onto the right path. So again, you're eating your food. Some of those carbs are turning into sugar. That sugar is going into the bloodstream. The insulin's coming in, but it's either not enough or it's not working very effectively. In either situation, the blood sugar is rising. So we have a greater concentration of sugar in the bloodstream. So how is a person going to feel? Well, initially, a person with higher blood sugar usually starts to feel a little bit thirsty because the body is going to recognize that there's too much sugar in there. And so it's going to say, hey, drink more. Let's dilute that. So maybe you're drinking water, maybe you're drinking Hi-C fruit punch, maybe you're even drinking soda, especially if you don't know you have diabetes and you're just trying to reduce that thirst. But you're going to be drinking more. Well, because you're drinking more, the other thing you're going to be doing is running to the bathroom more. And the secondary piece to that is that your kidneys will also recognize, your kidneys are a big filter of your bloodstream, and they're going to recognize that you have extra sugar in your bloodstream. So your kidneys are going to start saying, all right, well, let me try to pull more sugar into the bladder so that the person can urinate that out. And so your kidneys are working overtime as well. So maybe if you slept through the night perfectly without any issues, all of a sudden you're waking up 2, 3, even 4 times in the middle of the night to go to the bathroom. All of your energy, all of your sugar, right, is sitting in the bloodstream. It's not getting out into the cells. So your cells are starving. Therefore, you feel tired, you feel weak. You're not getting any energy necessarily into your body. So if all of your calories, if all of your energy is sitting in the bloodstream, you can actually shed weight, which sounds like maybe it's a good idea, but it's a very unhealthy weight loss. So individuals who are diagnosed with type 2 diabetes often have a bit of a weight loss prior to their diagnosis. They felt horrible, they were sluggish, they were tired, they were hungry all the time, but they also had some weight loss with that as well. So again, your cells are starving. So your cells are sending a signal like, hey, eat something. I'm not getting any sugar down here. So that's just adding to the issue as well, because maybe you're eating breakfast and then by 10 o'clock in the morning, you're like, I cannot keep my eyes open. So you're grabbing a Snickers bar, or you're grabbing a Coca-Cola, whatever it is, so you can get through your morning till you get to your next meal. So all of those changes, we often, believe it or not, tend to ignore because they don't come on rapidly. It's not like Monday you feel fine and Tuesday you're running to the bathroom drinking like crazy. They come on very gradually. So oftentimes people dismiss them. I'm getting older, I'm a little bit more tired than normal. So we don't necessarily pay attention to those signs. However, as we start to progress and those blood sugars stay high for an extended period of time, the body's going to start having some changes that are going to alert us. One of them being blurry vision. So remember, if your bloodstream has a high concentration of sugar in it, the bloodstream is unhappy. So it's going to want to try to dilute that as best that it possibly can. And so even if you're drinking a lot of fluids, that might not be enough for the body. So one of the things that the body will do is literally kind of suck any fluid in from the rest of the body into circulation. So dry mouth, dry eyes, dry itchy skin, all of those things can be very common. Just overall, really dehydration is how the person would feel. But dry eyes, we have a huge batch of fluid, if you will, behind our eye called vitreous and aqueous humor. And that can be depleted when our blood sugars are really high. And so that can lead to blurry vision. And that would be something that would prompt a visit to an eye doctor. Hey, I can't see anymore. I think I need a new prescription. And then the eye doctor would be able to look in the back of your eye and honestly be able to see that there are some changes back there that would warrant a follow-up with your primary care doctor. So again, dehydration, overall dehydration. And then the bloodstream is 98.6 degrees, right? That's the temperature of the human body. And now it has all of this sugar in it, which is a fuel source for bacteria, viruses, funguses. So you have a warm, almost hot, right? Sweet environment for bacteria and viruses to grow. So it is really the perfect medium, the perfect environment for these things to grow. So we always recommend that individuals with diabetes get a flu vaccine, get the pneumonia vaccine, because it's so easy for these viruses to grow inside of the body because it has everything it needs, the warmth and all of the food. I'm just going to touch on for one moment the current situation happening, which is COVID, right? So we talk about individuals with diabetes being at risk for coronavirus. And it's not that you're at a greater risk of contracting it, it's that you're at a greater risk if you have diabetes of it causing more problems in your body. And one of the reasons is what I just mentioned. So if your blood sugar levels are elevated, that means that you have a beautiful bloodstream right now that if you contract that virus, will grow that virus faster than any real medical help can provide. And we do have some great treatments out there right now that they're working on, but that virus will grow much faster and it'll take that much longer to get over. So that's really where one of a few connections with diabetes really comes in there. So let's say that you have that extreme thirst. You're going to the bathroom often and you feel uncomfortable, you feel tired, you feel sluggish, and you go to the doctor's office and you're like, Doc, I don't feel good, something's different, I'm going to the bathroom all the time. Your doctor will likely do a blood test to check to see what your blood sugar is. And this middle row here where it says random blood glucose, that is a blood sugar level that is random throughout the day. It could be that you ate 5 minutes ago, could be that you ate 5 hours ago, could be that you ate 5 days ago. If that blood sugar is less than 140, we would consider that individual to be without diabetes. If that random blood sugar is somewhere between 140 and 199, we would say, could be a situation of pre-diabetes, doesn't really have a number high enough to be considered having diabetes, but something that we should watch. If that blood sugar is 200 or above, that is a positive sign for diabetes. So say it's 1 o'clock in the afternoon, you had lunch an hour ago, you went to the doctor with all these symptoms and your blood sugar was 225. Your doctor would say, blood sugar is a little bit elevated. I'm a little bit worried about diabetes. Let's go for some fasting blood work tomorrow morning. So fasting blood work, what does that mean? Essentially, it means that you're going to eat dinner and then hopefully not eat anything after dinner until your blood work first thing in the morning. It doesn't mean that you have to fast for a full 12 hours. That we can certainly understand is almost near impossible for some people, but because of their work schedule, things like that, and getting to the lab at like 6 or 6:30 in the morning. But you certainly don't want to eat anything after midnight, and you certainly don't want to be snacking heavily at like 11 o'clock at night. So eat your dinner, and then generally speaking, nothing but water after that. So fasting blood work. So if I were to check your blood sugar fasting, if that number was under 100, we would consider that person to be without diabetes. Somewhere between 100 and 125 would be a pre-diabetic range, pre-diabetes. Greater than or equal to 126 would be a positive sign for diabetes. The other blood test that your physician would likely do is something called an A1C. And an A1C is a blood test that is done, it's a percentage form, and it's an average of your blood sugar for the past 3 months. And how it works is when you eat your food, some of those carbs, right, turn into sugar, and that sugar sticks to the top of a red blood cell. And red blood cells are constantly turning over every 3 months. So if I were to draw your blood today, what's today's date? The 16th, right? So if I were to draw your blood today, I'd have some blood from November, October, September, maybe even a little bit left over from August. So I'd be, the lab is literally scanning those blood cells, those red blood cells, looking to see how much sugar is on them, and then providing them in a formula that's beyond my knowledge base, but providing a percentage of what the average blood sugar is. So it's a great test, but it does have some limitations. So if you are anemic, meaning that you are not making red blood cells, the test doesn't necessarily work for you, obviously. If you've had extreme blood loss in the past 3 months, then the test would not work for you. If you've had a blood transfusion, meaning that you got somebody else's red blood cells in within the last 3 months, then that's not representative of your body, that's representative of your donor's body. So, so there's a few things that would make that test somewhat invalid. Other than that, it really is the gold standard for diagnosing diabetes. So if that percentage is under 5.7%, that would be a person without diabetes. Anywhere between 5.7 and 6.4% would be prediabetes. And then greater than or equal to 6.5% is a positive sign for diabetes. So this just kind of gives you a graphical understanding of how the A1C correlates to blood sugar, an average blood sugar. So you can see that on the left-hand side, a 6% A1C gives you about 126 average blood sugar. And as you get up to like 11 and beyond, the average blood sugar is well over 200. So certainly if you have an A1C average of 12, 13, 14%, which is not uncommon with an initial diagnosis of diabetes, we can certainly faithfully, confidently diagnose somebody with diabetes, and then certainly get them on a regimen that can pull those that A1C down. The goal is to keep an individual with type 2 diabetes under 7%. We know that complications with diabetes, or we start to think about complications with diabetes at around the 8% mark. So keeping them under 7% kind of keeps you a full percentage point away from those potential complications. So who's at risk for developing diabetes? So certainly there are some people who are more at risk than others, and certain risk factors we can change and certain risk factors we cannot. So things that we cannot change, we call them non-modifiable risk factors. So if you ever went to the doctor's office and they diagnosed you with prediabetes, that certainly puts you at risk for developing diabetes. Ladies, if you had a history of gestational diabetes, which means diabetes during your pregnancy, that will put you at greater risk for developing, for lifetime risk really, for developing type 2 diabetes. Family history. So regardless of if we want to try to deny those family genes, we can't get rid of them. So mother, father, sister, brother with a diagnosis of diabetes will automatically put you at greater risk for developing diabetes as well. Certain ethnicities, so African American, American Indian, Hispanic American, and Asian Americans all have a greater risk for developing diabetes as well. And then age. So we talked about the fact that the pancreas is the organ that produces the hormone insulin. The job of the pancreas it's a larger job than in the endocrine system than just insulin production. Actually, insulin production represents only 1% of the pancreas's function. So any kind of insult or injury to the pancreas can certainly lead to a diagnosis of diabetes. But as we age, our organs age as well. So the belief is that if we all live long enough, we would all have some potential for type 2 diabetes, because again, it's only 1% of the pancreas's function. But there are some risk factors, so we can't change those things. I mean, I would love to be able to change my age and not age at all, but that's not going to happen. But there are some things that we can change. There are some risk factors that we can modify. So as I was saying before, if we're overweight, that automatically puts us at greater risk for insulin resistance. So weight loss is definitely something that we can strive for. If you remember, I said after you're done eating and there's some sugar left over in the bloodstream, the body can try to store it in the liver. And then once that fills up, it can try to store it as a fat called a triglyceride. So if those triglyceride levels are elevated in your cholesterol panel, it's a potential sign that your blood sugars are elevated after meals and your body's trying to find ways to store that. So if that blood sugar, if those triglycerides are elevated, something that you can work on through, again, diet and exercise to try and pull those the triglyceride level down. I'm in a different office today, but normally I have a water bottle for a demonstration, and I realized I forgot it as I got to this slide. But if you think about a water bottle, right, and nice and fluid, and the water's moving back and forth very easily. If I was adding a ton and a ton and a ton of water into that sugar into that water bottle, represent what the bloodstream would look like when the blood sugar is elevated, that water would get thicker and thicker, potentially to the point where it's like Karo syrup. And so if I'm slushing around a water bottle that doesn't have really any sugar in it, not a problem. If I'm trying to slush around a bottle of Karo syrup, right, it's going to slowly drip from one end to the other. If I roll it over, again, it's going to slowly drip. It's going to sluggishly slide instead of moving very fluidly. So think about your heart. So if your heart is trying to move water through the body, it's very easy. It's not very hard at all. If your body is trying to move that Karo syrup through the body, the heart has to work harder to push that through because it's so sluggish. So again, one of the things that we can work on is trying to modify our blood sugar levels, because hypertension, high blood pressure, and diabetes kind of go hand in hand. So there's a huge correlation between diabetes and heart disease, and that just kind of is like the tip of it. But one of the reasons why we really want to monitor the blood sugar levels and make sure that we keep them in control, because it's very preserving to the heart as well. Stress. So I could talk about stress for an hour, but physical stress, emotional stress can have a huge toll on the body, one of which is the potential for diabetes. So whenever the body senses stress, so I need to act or react to something, I'm feeling stressed at the moment, the body will release, remember we had that little liver storage, right? The body will release the sugar that's been stored in the liver, because the body's trying to help you. It's trying to help you act or react to whatever you just identified as a stressful moment. Maybe that's traffic. Maybe that's you're at work and you forgot a deadline, or a terrible email came through, or whatever the case is. But usually our stress is not that we're actually trying to fight, flee, or run from anything. We're usually quite sedentary. And so what's happening is our body's releasing the sugar to say, hey, here you go. I recognize that you're stressed out. And then all this sugar goes into the bloodstream, in addition to all these hormones and such. But then it's just sitting there and we're not utilizing it. So being under stress for an extended period of time can certainly lead to a potential risk for a diagnosis of diabetes. So stress management techniques can be very, very beneficial. So yoga, breathing, just exercise in general, things like that. So what are the different types of diabetes? So type 1 diabetes is what we now call the diabetes that we used to call juvenile diabetes. So unfortunately, kids are more likely to develop type 2 diabetes at this point, so we've renamed things. But type 1 diabetes is a situation of an autoimmune response where the body actually attacks the cells of the pancreas that are making insulin, and then these cells die off and the individual is incapable of making any insulin. So this is type 1 diabetes. This is pure insulin deficiency, right? So the pancreas is not making any insulin, so the person is deficient in the ability to make insulin. The only drug we can give this individual is to supplement what they're not making, so this person goes on insulin. And there's a variety of ways that this person can receive their insulin. There's different types of injections and mixed insulins and insulin pumps and different types of things. But there are lots of different insulin deliveries out there. But this person must be on insulin, and it's the only medication that they can use to treat their diabetes. This represents about 5% of the population of individuals with diabetes. Type 2 diabetes is the situation where it starts out as insulin resistance. So again, those keys are not opening up the cell doors, may or may not lead to a situation of insulin deficiency, depending upon how that individual's family history is, depending upon how well controlled the diabetes is. So usually we start out with oral medications, possibly some injectables, and maybe or maybe not moving that patient onto insulin at some point. So this is type 2 diabetes. And again, this is the majority of the people with diabetes, about 95% again of the population with diabetes. We have a category of pre-diabetes. So if you remember that middle row, those labs that we were talking about before. So the numbers are not low enough to be considered without diabetes, but they're not high enough to be considered an individual with diabetes. So this is an area of watch, really. So pre-diabetes is an area where we want people to come in and see us in our diabetes education office so that we can provide the education for how to manage that and how to hopefully prevent or at least delay the onset of diabetes. And then gestational diabetes, which I'm really not going to spend any time on in our discussion today, but is diabetes during pregnancy. And once that baby is born, that mom does not have diabetes anymore, but has the risk of developing type 2 diabetes. So again, these are the different types of diabetes. But with all of these types of diabetes, one of the things that we like to see, or that we often will ask patients to do, is to monitor their blood sugar. Because monitoring the blood sugar provides a lot of information to the clinician, and certainly can help us in dosing oral medications, dosing, of course, insulin, but just kind of giving us a picture. Because an A1C, while it's great information, is giving us a spread of 3 months. But it doesn't tell me when the blood sugar is elevated. It doesn't tell me if the blood sugar drops at all. And so if I really wanted to in and figure out which medication, what time you should take it, what dose would be best for you, it's always good to be checking your blood sugar at home. And so if you're new to diabetes, if your physician is suggesting that you work on lifestyle changes and getting into a routine of exercise and perhaps learning some meal planning and such, we would not really add checking your blood sugar into that routine because it's a little bit too much to take in all at one time. But as we start to move through the process, it is something that we would generally ask of most of our patients once they start getting comfortable with the diagnosis of diabetes. There are definitely correct times, or good times, I should say, to be checking your blood sugar. And on the right-hand column are those times of day. So that's upwards of 8 times a day. So rolling out of bed, go to the bathroom, wash your hands, check your blood sugar. That's a fasting blood sugar. That is the most important number to get under control. If you wake up in the morning and your blood sugar is 300, now we add stress of just life. We add food to that scenario. It's going to be very hard to get that blood sugar under control. So that's the first and most important one that we're going to try to get under control. If you're somebody that gets up in the morning and then does 50 different activities and then sits down to eat breakfast, believe it or not, your blood sugar is going to be different from the time you woke up to the time you ate breakfast. So you could check again before breakfast. And then you could check to see how that breakfast affected you. You could check 2 hours after that meal starts, and you would see your peak for that meal. So before breakfast, 2 hours after breakfast starts. You could check then before lunch, 2 hours after lunch starts, before dinner, 2 hours after dinner starts, and then you could also check before you go to bed at night. So for the most part, most of our patients, most of our clients would not be checking 8 times a day. That seems kind of torturous. But what we do ask patients is to do what I like to do is called paired testing. So literally taking a meal and testing before and after. So typical breakfast, test your blood sugar before, test it after, 2 hours after you start eating. And that's going to give me a great indication of what your starting point is, what your ending point is. If I know what you ate, that's even more information and even greater information for me. But it lets me know how the blood sugars are running, how high potentially they are going with the meals. It's great information. So one day you might test breakfast. Another day you might test before and after lunch. Another day you might test before and after dinner. Then another night or another day you would test before you go to bed at night, and then the next morning when you wake up. So did you go to bed at 1:50 and then wake up at 2:10? So if you didn't get up in the middle of the night and eat a piece of chocolate cake, what in the world happened in the middle of the night that made that blood sugar rise? So that's something that we can address. That's medications that we can focus on, but that's a process that I would want to know that's happening so that we can address the situation, okay? So what are the goals? Like, where should you be? So the top line is just to give you a reference point for a person without diabetes, but an individual with diabetes is the bottom row. So waking up in the morning or before any meal, the goal is to be somewhere between 80 and 130. So again, waking up in the morning or before a meal. 2 hours after that meal starts, you should still be under 180. But there's a secondary piece to that. The goal is really not to rise within a meal more than 50 points, 50. So if I woke up in the morning and my blood sugar was 85 and I rose to 175, that's a 90-point rise. I'm still technically within those targets, right? But I rose way too many points. So it would be something that we would look at. Is it the carb count? Was it the medication wasn't correct for that meal? Whatever the case is. On the other hand, let's say you woke up in the morning and your blood sugar was already at 180. And then you checked your blood sugar 2 hours after that meal and it went to 200. So both of those situations are out of the target range. However, you only rose 20 points with the meal. The meal was fine. I wouldn't be concerned about that. The bigger concern would be the fact that you entered that meal with an elevated blood sugar. And so that's the piece that we would address. So this is why I like paired testing, because I like to know what my starting point is so that I know if the ending point is appropriate or not. So that's what I generally educate my patients with. And then this is the sample log sheet, and I also gave you a copy of this in your handouts. This is the sample log sheet that I give to my patients. So if you truly only wanted to test once a day, logging them in those columns and filling up a log sheet with that information gives me a great once-over glance to kind of get a feel of what the trend is. And believe it or not, everybody has a trend. So many times patients will say to me, my blood sugars are all over the place. There's no rhyme and reason. That happens generally few and far between. Most people do have a trend. It's just that we're testing at different times during the day that don't necessarily correlate to those time frames, and so we're not necessarily seeing the trend or the pattern. We're just seeing huge fluctuations in blood sugar that don't necessarily make sense. So starting to log your blood sugars, fasting before, 2 hours after a meal, you'll start to see what that trend looks like, start to see your own personal trend. Oh, I'm always high before dinner. I wonder why that is. Or I'm always low before lunch. What's going on there? So, checking into that and logging into that. I always encourage people to add notes to that as well. So if you're eating out at like a Chinese buffet, or you've gone to a birthday party or a wedding or Thanksgiving, those are all meals that we tend to negate a little bit because we know we're going to be eating more carbs than we normally do. And so we're looking more at trend and not one particular situation. If exercise is new or you're starting up exercise, letting your practitioner know that is really important as well. certainly illness, stress, any kind of pain that you're suffering from, any kind of new medications, especially steroids. Steroids have a great effect, unfortunately, on blood sugars. So knowing that a person's on steroids really does help us to figure out what plan of care to use. So there was a study that was done called the Diabetes Prevention Program. And basically, this study proved that the onset of diabetes can be delayed or even prevented by doing just a few things. And so in the study group, what this group did was they lost some weight. They lost about 5 to 10% of their total body weight. So as an example, if you were 200 pounds, we're talking between 10 and 20 pounds of weight loss. So we're not looking at extreme weight loss where, you know, that TV show where the people were losing like 30 pounds in a week. Doesn't necessarily need to be the situation. We want healthy, steady weight loss, 1 to 2 pounds a week. And so over the course of a few months, we're going to see the weight come off and we'll see some reduction in insulin resistance. The other thing that the study group did was that they exercised for 150 minutes a week. And in the study, what that looked like is 5 days a week for 30 minutes. So we have a little more information, and I am going to talk more about exercise in a moment, but we have a little more information on that and how we can kind of break that time up as well. But the joy of what came out of that study is to learn that we can absolutely delay the onset of type 2 diabetes. So let's talk a little bit about exercise. Exercise has a lot of benefits besides improving our blood glucose control. It's so heart healthy. So if you see a cardiologist, I'm sure a cardiologist is telling you to go exercise as well, because it can lower your blood pressure, your resting heart rate, it can improve your cholesterol level. We know with diabetes, one of the situations that you can potentially suffer from is elevated triglycerides, which is a cholesterol. It strengthens the heart. So if you think of the heart as a muscle, right? If I wanted to strengthen my biceps, I could just keep lifting weights and eventually my biceps would get stronger. But my heart is situated inside of my body. I can't lift any weights. The only way I can really strengthen my heart is through aerobic exercise. So we love exercise for that. It can reduce your body fat and your overall weight. It helps with the immune system, helps with our stress. If you ever just feel totally overwhelmed with something, you go for a walk, the situation isn't necessarily resolved, but you feel a little bit better. It's because you're using those stress hormones to do something and you start to feel a little bit better. When you exercise, your mood can certainly improve. It can help you sleep, get a more restful night's sleep, and it can actually improve your memory as well. So lots of great benefits to exercise. So again, the goal based upon that DPP, the Diabetes Prevention Program, is 150 minutes each week. So what does that look like? So we utilize the acronym FIT, F-I-T-T-E, to determine your exercise plan. So the F standing for frequency, how often should you exercise? The I standing for intensity, how hard should you exercise? The T standing for time, how long should you exercise? The other T for type, what type of exercise? And I always add an E because if you don't enjoy it, you're probably not going to do it, right? So for frequency, daily activity should be part of your lifestyle. So you don't want to have 2 sedentary days and then get up and exercise for 5. You really should be active every day, but you want to exercise beyond your comfort zone 5 days a week. And you really shouldn't go more than 2 days in a row without exercising, because your body kind of builds on itself. And so if we spend too much time, think about like if you've ever been sick with the flu, you're down in bed for a week, you get up, you're not back to your normal self again. It's going to take some time to kind of get back to what your typical energy level is like. So again, no more than 2 days in a row without exercise. Intensity. This is a little bit harder to really talk about, but you should feel like you are comfortably working. You should be sweaty. Your heart rate should increase, but you shouldn't be so overwhelmed with the exercise that you can barely catch your breath. So what I suggest is that people do something called the talk test. So if you're breathing heavily, you could barely answer a question, you're exercising too hard. If you're speaking in long-winded sentences like I am right now, you're clearly not probably exercising enough. So it's a great test to kind of do. It requires you to either talk to yourself, but you know, hopefully have somebody with you while you're exercising, and that can be motivating in and of itself. So how long should you be exercising? Again, good to be active every day. The goal is to exercise 30 minutes. And initially in that first study, the DPP, it was 30 continuous minutes. But we know now through other studies that you can break that 30 minutes into segments and still receive a great benefit from exercise. So there is a study that does suggest that exercising after your meals can be very beneficial to the blood sugar level, that 2-hour post-meal blood sugar. So, you know, certainly for people who are new to exercise, that's what I recommend. Take a walk after each meal. Take 10 minutes. We all have 10 minutes that we can devote to ourselves. Take 10 minutes. Do some laps in the office, go walk to your car and come back in. Different things that you can do to just add a little bit of a walk after that meal. Help kind of move that food through, get yourself a little bit active so that the insulin's working appropriately on the food that you just ate. Just a little note. So if you are not going to make any dietary changes, if that's not a goal for you, which is fine, you will need about 45 to 60 minutes of daily, so that's 7 days a week, exercise to achieve any kind of noticeable weight loss. So it's the combination usually of meal changes and exercise that really make that beautiful combination of weight loss. So the type of exercise that we're looking for is aerobic exercise. This is what burns the fat and the sugar and gives us the greatest benefit of blood sugar control. So that's things like walking, jogging, biking, the elliptical cycle, swimming, dancing, soccer, rowing. All of these things are really the exercises that we would point you towards. If you mix up the different types, so you bike some days, you walk other days, you tend to burn a few more calories that way. And then again, like I said, if you're not going to enjoy it, you're probably not going to stick to it. So do choose things that you enjoy. Definitely start out with light exercise. If you're just getting into it, take your time, do 10 minutes for a day, and then maybe another day, add another 5-minute segment, work your way up, because too fast, likely that's when people tend to give up. Try classes. You can go online, you can go in person if that's comfortable to you. Try to keep your self-talk really positive. So if the whole time you're exercising, this is horrible, when is this going to be over? Chances are you're probably not going to stick with it. So try to keep positive thoughts in your mind the whole time, so that you come back to it. And then let your mind wander. You know, that's a great thing too, listening to different things on the radio, or if you're on a treadmill watching TV, those are all great things to just kind of let your mind go, and you kind of forget about what it is that you're doing. There's a few apps here, Insight Timer, Headspace, and YouTube, which all have great exercise programs, yoga programs, stress management techniques, different things like that to tap into. I know we're a little bit isolated right now, and it's hard to find ways to exercise, but these are great apps that you can work with. So one of the other things you can do is try to just increase your steps in the day. And so the idea is that if you walk 10,000 steps in a day, you've walked about 5 miles, you've probably done some formal type of exercise, a great way of being healthy. You can get an app on your phone. You could go out and purchase a Fitbit or some type of a pedometer, and just kind of see what your typical step is in a day. So how many steps do you typically do in a typical day? And then your goal will be to just try to beat yourself. So if you do normally 5,000 steps in a day, so tomorrow try to get to 5,500 or 6,000 steps. Again, just trying to beat yourself. It's almost like a game with yourself. Can you get to 10,000? Certainly you can compete with other friends and family, things like that, make it a little bit more fun. But again, that's a great way of just adding more steps, parking further at the grocery store, using the stairs instead of an elevator, going up the stairs to use the bathroom in your home, you know, different ways that you can just kind of add a little bit more activity in your day. I I know we're running out on time here, but I want to talk really briefly about meal planning. So the nutrient, of course, that we've been talking about this whole time that has the biggest impact on our blood sugar levels is our carbohydrates. Carbohydrates are found in dairy products like milk and yogurt. They are not found in cheese. So cheese is not considered a carbohydrate. Bread products are carbs. So that's English muffins, bagels, hot dog and hamburger buns, tortillas, waffles and pancakes, snacks such as chips, popcorn, pretzels, all I call them like the Super Bowl Sunday foods, right? Like Doritos, things like that. Cereals, hot cereals, as well as cold cereals. So any of the cereals that you would get. Starchy vegetables like potatoes, peas, any kind of beans. So black-eyed peas, kidney beans, lentils, as well as corn and corn on the cob. Pasta, of course, rice, of course, and then any kind of a fruit. So fruit is just naturally sweet because it's made by Mother Nature, and Mother Nature puts that sugar in it. But I want to stop for 1 second and say that none of these foods are bad. The only food that I would ever recommend that you not have as an individual with diabetes is regular soda and regular juice. They just have way too much sugar in them. It's very hard to control a blood sugar when you consume those, and certainly when you consume those on a regular basis. But these foods that we just mentioned right here, they're not necessarily bad for you. In fact, they're all really great for you. They all have great benefits. The goal is to figure out the right balance so that you can have them, but have them in the right amount. And so what we teach is something called the plate method. And so if you take a typical plate, like about a 9-inch plate, and you cut it right in half of your plate should be vegetables, vegetables that are not starchy. So broccoli, green beans, cauliflower, typical salad foods, all of those things would be considered non-starchy vegetables. And you could load half of your plate with those. The other half of your plate is going to be split again, and a quarter of that plate, some type of a protein. So beef, chicken, fish, cheese, eggs, nuts are considered a protein source as well. So protein, kind of when we marry protein with carbs, it kind of actually reduces how much of a spike that blood sugar is going to have with a meal or with a snack. So for example, you're kind of hungry in the afternoon, you have a few crackers, plain crackers, your blood sugar is potentially going to spike. But if you put maybe some peanut butter on those crackers or some cheese on those crackers, that protein is going to help your body process that carb a little bit differently, and you won't have such a spike. So we like protein. So again, chicken, beef, fish, eggs, nuts, cheese, all good protein sources. Also your alternative things like tofu, hummus. The other quarter of your plate, right? So we have half of a plate of vegetables, a quarter of a plate, some type of a protein. The other quarter of your plate is going to come from that starchy source. So that's going to be your rice or your beans or your or maybe a side of chips when you have lunch, or maybe you're going to have a glass of milk with your breakfast, or you're going to have some fruit, whatever the case is. But that's pretty much the distribution that you want to see. So you're looking really not to avoid foods, but to balance it out. So this is just one example, right? So some chicken, some rice, and some vegetables, but there's plenty of different options that can kind of allow you that distribution. The goal is to eat 3 balanced meals a day. Try to, spread those meals out throughout the day. Starting your meal with a glass of water and sipping water between bites of meals can also help as well. If you begin your meal with your protein choice or your vegetable choice, it actually will help your blood sugar control, because it's letting your body know, hey, I'm eating, and then the insulin's going to get released, and it's already going to be ready by the time that you eat the carbs, and the carbs start turning into sugar. So starting out with that protein or vegetable first really does help. I always suggest, rather than shoveling the food in, which is what we often tend to do, have a bite, enjoy it, put your fork down, and then bring in the next bite of food. So really try to enjoy that meal. It takes 20 minutes for that meal to then hit your brain and tell your brain you're full. So in 20 minutes, I could certainly very easily put down a couple of slices of pizza. So again, slowing that down, taking a few bites, putting it back down again, having a side salad with it. I certainly wouldn't eat as much. Use a smaller plate. That's a great tip. So actually the amount of food on both of those plates in that picture there is the same. It's just that one plate looks full and hearty and the other plate, it looks like you're not getting enough food on that plate. So sometimes just changing the plate size really will help you. So breakfast is the most important meal of the day. And you really want to make sure that you are eating that meal, kind of starting off that body, cycling through that so that the body can start utilizing those carbs for fuel and kind of work off from there. Meals should be spaced about 4 to 5 hours apart. You do want to try to plan your snacks ahead of time so that you have healthy snacks available to you, because when you don't have that healthy snack around or available to you, that's when we tend to grab the things that we shouldn't be grabbing. Portion out your plate, maybe in the kitchen, and then bring it into wherever it is that you're eating, because then that will help benefit you so that you're not necessarily grabbing all the seconds and things like that. So portion out ahead of time before you sit down to eat. Put the leftovers away immediately. Sometimes that helps as well. And remember that it's okay to have food left over on your plate. I know that I grew up in a time where you needed to finish everything on your plate, but we don't really necessarily need to do that. Listen to your body. Your body says, you know what, I think that's it, we're done. It's okay. It's okay to not finish what's on your plate. I know I'm am I a little bit over? So I want to thank you so much for the opportunity to talk with you today. I know I filled it with chock full of information, but I certainly welcome any questions that anybody might have at this point in time.
And thank you so much, Laura. Yes, if anybody does have any questions, please, you can submit them using the questions box, and we'll be happy to answer them for you. So let's give a couple minutes and see if any come in.
Okay, sounds good. Sounds good. So while we're waiting for that, I'll just say thank you again so much for allowing me to participate today. I hope that, you know, maybe you gained a little bit of something, some insight that will help you with your diabetes management.
All right. What is the normal range for A1C?
So a non-diabetic range would be less than 5.7%. Pre-diabetes is 5.7 to 6.4, and anything over that would be a sign of diabetes.
I have a 5.5 to 5.6. Is that worrisome?
Not at all. That would be considered without diabetes. That's completely normal, if you will.
Would that change if they had a severe family history of diabetes?
No, I mean, it'd be something that we would take into consideration, but a 5.5 to a 5.6 is completely normal. That's what we would see with anybody that is without diabetes. So absolutely perfectly fine and wonderful. So, you know, keep doing what you're doing.
Any advice for a pre-diabetic vegan?
So actually vegetarian slash vegan, hold on. Sorry. I am in the hospital today. So vegetarian vegan diet is extremely healthy. It's very healthy. So the distribution would really be the same. You know, your protein choices, if you're using tofu, whatever your alternative choice is completely fine. Lots of vegetables. So making sure that you're eating a lot of vegetables. Oftentimes vegetarians or vegans tend to eat a lot of carbs. It's like the go-to thing for them. But you just want to be careful if you have diabetes or pre-diabetes, that's not your go-to food. You know, you do want to balance the protein and really focus more on, you know, the vegetables, things like that. And then with pre-diabetes, making sure that you're exercising and getting that 30 minutes in at least 5 days a week would be really important.
Is it good to just not eat any sugary foods?
Sugary, is that what you said? Sugary
Yeah.
foods? So you know, of course, if we were like never eat cookies or cake again, that would be great. No candy, things like that. But I don't know that that's necessarily something that people could live with. I don't know that that's a very fair judgment to make to people. I know that I try not to say that to anybody because I try to only offer advice of which I would follow myself, and I would not follow that advice. So if you can avoid sugary foods, if you can avoid all of those concentrated sweets like cake and cookies and things like that, of course that's healthy. But as a general rule, we don't necessarily say that. You just, again, you want to balance that out. So if you know you're going to a birthday party, you know you might have a piece of cake, probably not going to have 3 slices of pizza and wash it down with a soda, right? That would just be too much. But, you know, maybe before you even head out to that party, have a salad at home. Start to fill yourself up a little bit so that you're not necessarily picking the things that you shouldn't.
My mother and sister have diabetes, and I was diagnosed with pre-diabetes, but turned it around with diet and exercise, and I'm no longer pre-diabetic. Would it be possible for me to still get diabetes?
Absolutely. So if you have a history of prediabetes, even if that history goes away, so to speak, and your A1C drops below 5.7%, so that you're considered an individual without diabetes or without any risk, because you have the history of prediabetes, it does put you at risk. It just means that you need to be mindful. You know, you need to continue to do whatever it is that you're doing that keeps you out of that pre-diabetes range. So maintaining the proper weight, maintaining your meal distribution, exercising on a regular basis, all of those things.
How often should you have your blood work done?
So that's a great question. So remember I said that on the A1C, it's an average of 3 months of what your blood sugar has been doing, because your red blood cells live for about 3 months. So there's constant turnover. So if you had, if you went to the doctor's office on September 1st, and your doctor said, okay, looks like diabetes or pre-diabetes, and you were like, okay, I'm gonna start exercising, I'm gonna change my meal plan, and I'm gonna do all the things I'm supposed to do, and you go back to get blood work on October 1st, you have September blood in there, which is going to be very representative of what changes you made, but you're still going to have August blood in there, and you're still going to have July blood in there, which is representative of your diagnosis of diabetes. So you're not going to get a very fair picture of the change that you made. So anytime you make a therapeutic change, you have to wait a full 3 months to see how that therapeutic change really did affect the A1C. So 3 months is the standard for blood work. You certainly push that to 6 months if you're at goal and you're at target. You don't need to necessarily get it done every 3 months. But if we're looking for making some changes or looking to pull high A1Cs down, you have to wait 3 months between lab tests. And some insurance companies will actually deny a blood test if it's done before 3 months.
Somebody commented a very good class. So,
Oh, thank you.
another person, thank you. This was very informative.
You're welcome.
Yes, somebody asked if they could have your contact info. I will be sending that out in
Sure.
my follow-up email. It'll have all of the information you could possibly want. So look for that in the coming days. So. Alrighty. Yeah,
All right.
Please do this again. Yes,
No.
this is
I'd be happy to.
always.
If you have a particular topic you want me to talk about. I know we didn't talk at all about medications. There just wasn't the time. I'm happy to touch on anything that anybody has a question about.
Absolutely. Well, all right. Well, I'd like to thank you, Laura, for presenting
Sure.
today. You were fantastic. I'd like to
Absolutely.
thank
Thank you.
everybody for attending today. Be safe, be well, and
Yes.
hopefully we'll
Yes.
see you soon.
Yes. Absolutely. Take care. Thank you so much.